I'm going to start recording us now, by the way.
Oh,
So,
great.
because we
Well,
have
welcome to the Governor's Child Foster Care Advisory Commission, everyone. This is our makeup meeting for those of you who remember last time we did not have enough members present to do business. It was kind of a colliding of the universe. Everyone had personal or work crises come up, and so we moved the meeting to today. On the agenda, we have, the business stuff. We do have elections, which we'll talk more about. We have discussions of the recommendations we have sent to the governor's office. We are connecting with Rachel Kearns Henry, who is our policy advisor with the governor's office. She's going to be talking to us about what's next with our recommendations and what she would advise that we do. And then we need to talk about our retreat coming up in the fall. And so that's the kind of the bulk of the meeting today. And I think really the business that needs voting is the minutes, so we can wait until we have our latecomers join us. Anything to add to the agenda or questions?
we also have the elections. How do we want to handle those?
Oh, sorry, those two need to, yeah, we'll have to postpone that until
Till
Judge
Judge.
Shannon is on.
Yeah.
So we'll roll that to the bottom. So then we can do introductions then, and then we'll jump into discussion of the recommendations.
Yeah. So with our introductions today, just note that it is the summer solstice, the longest day of the year. So with that, and there's a changing and a turning of the season and the tides. So if you just have maybe one thing to say about the solstice, or a goal for the second half of the year, or something that you just want to put out there into the universe, a positive thing for yourself, what that might be. So you can say your name and your pronouns if you'd like, and then something positive you'd like to put out for this as we turn towards, it's unfortunate to say we're turning towards darkness, but there's nothing wrong with that. It's just a part of the cycle of life. And let's see, I'll go ahead and go first. I'm Ellen Bell, and I'm the coordinator for this commission. And I think for me, it is that I feel like I'm trying to change domicile in this next 6 months. And so I just put out that the right place finds me. And I will popcorn it over to Seema.
Hi, morning, everyone. My name is Seema Stephanie. Let's see, and what would I do for the next half of the year? I guess overall, I've been trying since January. I can say I try for a month and then I lose track. But on a positive side, I'd like to find, Zen, sort of bring myself right to what's important in life, focus on that, and minimize my stress. That's me for the next 6 months.
I'll jump in. I'm Pamela Heisler, chair of this commission. In my day job, I work with Oregon Child Abuse Solutions. We're the statewide chapter for children's advocacy centers across the state. And I use she, her pronouns. And what do I want to put into the universe? I guess for me, just like good health and sleep in our house. We have just been through like the plague after plague after plague this year, and I don't know what is going on, but I was texting my friend yesterday. It was the first 7 days in a row where no one in the house was seriously ill. And I'm like, okay, I'm going to cross my fingers and we're going to roll with this. So that's what I want to send into the universe. Just some health and wellness in my household would be a beautiful, beautiful thing. And I will popcorn over to Casey.
I'm Casey Greer. I've been on the commission since 2021. I am a juvenile dependency attorney out of Roseburg, soon to be out of Cottage Grove. And I would put out in the universe that my transition goes well, because the whole reason I'm doing this really is to have more flexibility in my time and spend more time with my daughter. So I'd like to be off work, 3:30 and coaching Little League here in the next 6 months to a year. So that's my goal, and I hope it works out. I will popcorn stew because I want to ask how to pronounce your name. Is it Dean?
Don't worry. So my mother and my godmother combined D and Ian, and so that question is the question I get with literally every single person. So at this point, I sort of treat it as like me getting noticed. So or like also just a greeting. So you don't have to worry about offending me at all. I don't consider there to be any way to pronounce it as long as there's no one in the room with a similar name. So yeah, so Dean Salazar. I'm 24, former foster youth, and currently live in a adult in a group home. But I also serve in a variety of public roles. I serve on the Oregon Autism Commission, also as a self advocate, and as the social services co-chair there, the Portland Children's Levy, as well. And I mean, I was also the Lima Democratic Party youth chair. I've been in participatory budgeting Oregon, worked on a campaign. So I've done a lot of work in the political world, and I also tried to start a failed gaming business when a game design business when I was 17. So yeah, a lot of fun stuff. I'm also unique in the fact that I'm Latino. My grandfather had Pueblo. My great grandparents immigrated to Utah. They were Jesuit Mexican immigrants. And then my mother was also in the foster care system in a white foster home, white Protestant foster home in Utah because her mother wasn't able to take care of her. And then my dad was half Jewish. And then I lived in a few states. San Diego was the first where memories are from 4 to 7. So like City 8 to 11 here ever since. But when we moved here to West Portland about a year after, my mother got a violent relationship, violent boyfriend. So which is how I moved on to into the foster care system on the east side of not just of Portland, but east of 82nd, where I've lived ever since. So yeah, that's just a little bit about me. There's a lot more in the fact that but my ice cream is melting, and so, but yeah, it's nice to meet you all, and I look forward to introducing you all to my unique perspective and also views as we go forward and work together because I think they will be an asset. Your mic is muted.
I was just saying, I was so glad you could finally make it and we got the email situation figured out. So
really good. I've never used Workday in my life. I'm sorry.
Right. We found you. All right. Who are you going to pass it to, Dean?
Oh, yeah. I'll pass it off to Jessica.
Hi, good morning. I am Jessica Hawash, and I currently hold a position at WorkSource Oregon, running a CASE program called the STEP program, which is for individuals that qualify for food stamps, and we pay for training and help with job placement. I'm also the chair of the Equity and Inclusion Council for the State of Oregon Employment Department. So I run a lot of those kind of advocacy educational things. My pronouns are she, her, and for the last half of the summer, we are on a massive search for a homestead, but finding anything with land with a price that I want to pay is quite the struggle. So we're exploring the raw land, doing it ourselves type of world, but I'm not sure how we're going to do that with a newborn, but that is the goal. So manifesting 100 acres for $50. That's what I'm manifesting.
I would love that.
Right? Yeah. So I am not sure who has went. Let me look. Michelle?
Hi there, I'm Michelle Pfeiffer. I'm the legislative coordinator for both child welfare and for the Office of Training, Investigations, and Safety, which does all the child abuse investigations in residential like care settings, DD, foster home, host home settings, and then all these adult settings. So anyway, for my next 6 months, I would just say not feeling guilty about taking breaks. I have yet to really take a solid break from this new job over the past couple, I guess it's been like a year and a half so far, and I am intentionally taking 2 vacations and don't want to feel guilty or sucked back into work while I'm gone. So that's my goal. And I will pass it on to Donna.
Do not feel guilty, Michelle. Take your breaks. Hi everyone, I'm Donna Haney. I use she, her pronouns. I am the assistant manager in the foster care program for child welfare. And you know, all I can say is this is my favorite time of the year. I love the sun and the warm and the light. And yes, I know technically we're getting shorter days a little bit every day, but for the next 6 weeks or so, it just stays light way into the night, and I love it, and I love sitting outside. So that is what I'm looking forward to the next at least couple months. Then I'll like fall too, but this is my favorite time. And I will pass it to Alexis.
Good morning. My name is Alexis Amarelli, and I am the foster care ombudsman with the Governor's Advocacy Office. I have been in this role for about a month, so still lots of learning to do, but I'm very grateful to be here. My pronouns are she, her, and for the next 6 months, gosh, let me think. I think what I'm trying really hard to focus on is giving myself a lot of grace. I'm sure that everyone here is very familiar with Darren Mancuso, who has been in this position for the past 10 years, and he has done such a phenomenal job. And we joke around all the time that I'm not taking his shoes, that I have different shoes, and it's going to look different, and things are going to shift a little bit. But yeah, just having a lot of grace with myself in that transition, that I'm not trying to necessarily live up to what it was, but to just bring my own sense of self and really trust also the universe that brought me here, because all of the things that lined up and the fact that I'm here in the first place is wild. So grace and trust for the next 6 months. I think has everyone gone?
Good to see you again, Alexis, by the way.
Good to see you. Good to see
We
you
met
too.
at the Foster Youth Mental Health Summit, which
yeah, I remember.
yeah.
I have your card.
Oh yeah.
Yeah. Did everyone get to go?
No,
Oh,
Jamie
Jamie.
on, and Adam is joining us too, but he is having some difficulty. He's on a hotspot, I think. So,
Thank you. My name is Jamie Paris, and I have been with the commission for, well, there's some discrepancy. I'm not exactly sure. It could be a year, it could be 2. I know that I've been hanging out and participating for a while. So I am a birth parent. I was with Morrison Child and Family Services for quite a while, and as a senior parent mentor, and I've recently in the last 3 months switched roles, but I am here representing birth parents and kiddos, and so as a birth parent though. And for the next 6 months, my goals are to excel in my new position and like have that work-life balance and just be with my kids. Like when I leave this job at the end of the day, to have my phone off every single time and to just go home and be a mom and a wife. And that's really the skin I want to be in when I walk through the door. So that is it. And then Adam, did we lose Adam? Was it Adam?
We did, yeah.
Oh, we did. Okay.
Some internet
Thank you.
issues. Well, thank you all for those wonderful introductions. I'm trying to pull up my agenda here, and I have lost it. Here we go. Open it again. So the next item on business, we're going to skip approval of minutes and elections, is the recommendations. So you should all have received the document. It's about 7 pages, and it is attached to the meeting invite as well. If you don't have it immediately available, go to your calendar. You can click on it and download it from there. We did not have a chance after this was drafted to talk about it in person. So this is our opportunity to ask questions, vet any language, anything you've seen that is concerning or needs to change or anything missing. This is our chance to talk about it. And then we'll also have a chance to pose anything to Catherine Seltzer, anything around the education recommendation. She's going to join us in a bit. And then once Rachel comes if you have any questions for her, then that'd be the place to do it.
Would you like me to screen share that? I can pull that
Yeah.
up. Yeah,
Thank you.
yeah. Now I'm not used to doing Zoom after Teams, so this is weird, but I'm gonna. Mhm.
I feel like every time I try and do Teams, my computer crashes. I don't get it. I'm more of a Zoomer.
Oh, yeah, I gotta pull it back up. Let's see.
So while she's pulling that up, hopefully you've got it pulled up on your end too, and I'm hoping you've had a chance to look through it. And we'll just walk through it, I think, bit by bit and open discussion on each of the recommendations and see if there's any feedback, questions, changes, and then go on to the next one. Does that sound good? And the first section is in response to the special master's report around temporary lodging, which we all had copies of.
No. It's in here. Hmm. I think I'm sharing the wrong thing, so hang on.
You're good. This gives us time to look at it.
I'll talk more specifically about them, but I'd say that my bird's eye view of the entire document is, I'm really glad that we chose as a commission to kind of include all of the special masters report. I know that that was a little contentious last time, and I'm glad that we did include them all, and I was especially glad to see the additional recommendations as well, especially around some of the educational ones in the ICWA one. So my bird's eye view is, I think it's awesome. I think it's amazing. I think that some of them could be done administratively, some of them legislatively. There's a variety of different fixes that the governor can consider, and obviously we think they should all be done, but that's for them to decide. But from a bird's eye view, I think that it's a really awesome document with great recommendations, and I'm really appreciative of the staff that put time into putting together the document for us.
That was all Ellen. Thank you, Ellen. She took all of our ramblings and thoughts and made them coherent.
Well, thank you.
I think we can see it now. Is there a way to zoom in so we're just seeing one page just to make it bigger?
Oh, let me see.
It's under view, Ellen, on the top up there.
Under view, got it, okay. Zoom. Let's see. 100%? Oh, no. Yes?
Yep, and then just
Yep,
scroll
yep.
up.
Okay,
There
good.
we go.
That's
Can everybody
200.
see that okay?
Yeah. I have shared this with several groups. I shared it most recently with safety, with folks and the people that do the child death review committee, and they had looked at it and then they were just really thrilled with it, and they had some specific ones they were glad we were looking at. And I know Donna and I've talked about this, and it's been shared with other people. So I feel like we do have some folks from child welfare. Now, I haven't talked with Michelle much about this yet. I don't think we've spoken, but I think I've sent it to you. So one of the things, the reason why, just for everybody, just to jog your memory, the reason why we did all of the special master recommendations was because Rachel had asked us if we would. So this was one of her requests. So we decided to go through it and put a lot of detail into this, and then go ahead, because we've been focusing on education, to move into the educational aspect. Catherine was very pleased with the recommendations. And then also, then at the end, things that came from our meeting in April. I think it was April, yeah, when we brainstormed this. So you guys let me know where you would like me to go at this. I think you probably have it pulled up on your own computer, but do you just want to go through it, Pamela? And
Yeah.
if there's any comments on various things.
Yeah, so this first set of recommendations, again, these are all related to the special master's report on temp lodging. So under number 1, the guarantee of placement stability. Oh, that's funny. No problem, Dean. So there were concerns raised. Actually, I don't know. What kind of learners do we have here? Is better if we kind of read them out loud and you can think it through, or if we pause some silence for you to look at it really quickly and see if you had any thoughts.
Oh, are you talking to me?
To everybody.
I am a you read it out loud.
Okay, so I'll read
I'll
it. So
Lost in the paragraph. Yeah.
yeah, so several commissioners raised concerns that a third placement is too late for the triggering of an interagency response. However, given that emergency or short-term placements get counted by ORCIDS as a placement, it then makes sense that a third impending placement generating an interagency response is not necessarily too late. Short-term placements continue to be avoided whenever possible by ODHS. Still, it is critically important that any third placement be addressed, assessed, and alarms sounded. So it is on the radar screen of caseworkers. Oh, we scrolled too low.
I was just noting that the footnote
Oh.
that it's changed from the original version because
you.
respite does not count as emergency.
Thank you for clarifying that. Let's see. Oh, on a radar screen of caseworkers, supervisors, and managers. It says the special master recommendation should be implemented regardless of cost. So are we still on board with that? Any changes, any concerns, or are we thumbs up?
I am still on board with that. Yes.
I'm still on board, but can somebody give me a picture of what this looks like? Like, how do you guarantee placement stability?
You can't. You do everything you can. I mean,
I think the point of this recommendation is that it rises to the level of a bunch of people's radar before you've got 5 placements under your belt, 6 placements. So somebody came up with 3, the special master came up with 3 as the trigger to where people need to get together and evaluate the case and what's happening. So it doesn't mean that the youth child isn't gonna move again, but it's more eyes on it and nothing just happening through the cracks, kids falling through the cracks. So that's my understanding of the recommendation. It gets a lot more eyes and attention on the issues and efforts made to maintain stability. So look at why they're being bumped around, if the level of care isn't high enough, and address those things before you're on to, a dozen placements.
That makes sense. So,
yeah.
Sorry, go ahead.
Oh, no, sorry, there's a delay. No, and I think some of the additional recommendations as we go further down, we'll see that we also recommended like additional trainings and therapeutic homes and stuff like that, that I think we also were hoping will kind of combat even us getting to 3 placements. But yes, I think just a trigger in general at 3.
So I love that. So it sounds like what we're doing with this one is, this isn't anything that needs to be done legislatively. This is just, ODHS putting in place a trigger for when they see this, and maybe it's like a committee that reviews the case. Yeah, that's an easy fix. I love it.
Yeah, and I know that there are other triggers in the system, like if there's a third call to the hotline for a child under the age of, somebody in child welfare, you can jump in, I don't remember, is it 4 or something, 3? There's supposedly an automatic, some sort of alert where folks go out and investigate, even if it's closed at screening. So I think there are other examples of them doing this to alert folks to a need for extra attention. So the assumption is that it wouldn't be a huge lift, but don't know.
I just have a question for clarification in regards to this one. So are we saying that, do we have clarification of what exactly a placement is? Is it not at the original removal where potentially okay, we know that this child's only going to be here temporarily until we find a permanent placement? Is there a clarification somewhere that says a placement is like an actual foster home that has placement availability and the expectation is like that child will be there and then moved from that location? Or are we counting like number one from just like the respite provider or the emergency care placement when they're originally placed into care? And then when they go to the first foster home, that's considered one or two, I guess at that point it would be two placements. Do we have clarification somewhere in regards to that or?
Yeah, it's exactly what you said. The emergency short-term placement counts as number one.
Okay,
And one to a more, permanent, longer-term foster home would be two.
okay.
I
Gotcha.
just had a big argument, or not argument. I had a legal argument on this issue in court the other day because we were having a contested permanency hearing after the kids had been returned. And we argued that a placement is not with parents, but a placement is anything else in substitute care. So it's your initial removal, that's your resource parents, that's potential guardians, that's potential adoptive resources. It's basically everything but the parents.
And I believe we had a clarification that it didn't include respite, though. Respite was not included.
Right, because that's not a placement. That's a
Exactly.
different category.
And the legislature in 2023, I think, actually went through and defined placement, which previously wasn't defined.
Oh, good. I wonder if in response to all of this, who knows? So any other questions on this first recommendation or any suggested changes before we move on?
So do we have an option to put like a little tangent or something in the bottom? Because I also think big picture, if we are counting kind of that emergency respite at the original placement, when we actually hit the third placement, it's really like the second placement essentially. And so like if this is an administrative change where it's something internal with our caseworkers, I'm just thinking also like work to life balance, I guess, of an initial review of like, is it actually a failed placement, right? Number three, is it actually a failed placement due to lack of treatment? Or is this just saying that we will actually just do that review? We'll just look at it, right? It's just the trigger. Okay.
I mean, because I would be concerned as a commissioner if a kid gets put into 3 short-term emergency placements and they're on to their 4th. I want those counted, even if the 4th one is going to be their
Okay.
longer placement, because I want to know, why did it take that long? Why were there 3 moves beforehand? So I think in my mind, it's still important to count it. And then those eyes might look at it and say, this was the path we needed to be on, and now they're in a good placement and we're good. It doesn't necessarily mean that anything is wrong. It just your eyes on it.
I agree with that then. Yes, I agree with that. Okay. Thank you.
Good questions. Anybody else? I keep trying to scroll, Ellen, and I don't have control. Keep
Just tell me
forgetting.
when, Ellen.
Yeah, you want to scroll down so I can see all of 2? Or at least most of 2. There we go. So this is the second recommendation as part of Special Masters. And it is universal intensive in-home child-specific support for resource parents and kin caregivers beginning at placement. So all agree that this would provide better outcomes for children overall, but with a few points to consider. So it is difficult to get assessments within 3 days of placement, and there are long waiting lists for actual services. We know that. Rural areas have less availability of services and not enough providers. Wraparound services are vitally important, and more emphasis needs to be placed on funding in-home therapeutic support, skills training, tutoring, and peer support for both birth and resource parents. More emphasis on preventing original placement by utilizing respite and engaging family coaches and advocates to assist with keeping children from being removed. This is addressed later in the document. And then there were varying opinions on achieving the national target for permanency. It is a complicated issue that needs greater attention. Strict adherence to the national target doesn't always consider the needs of the kids or the complexity of substance abuse recovery for their family of origin, if relevant. Let's see, the challenge of reunification in 1 year.
I have something. This is Jamie.
Yeah.
I don't know. Can we go back up a little bit? It says substance abuse. Can we put substance use disorder or substance use recovery? Is fine as well. But we want to change the stigmatizing.
Yeah, no problem. Substance use disorder.
Substance use, I think, take out abuse, right, Jamie?
Yes.
Yeah, substance use recovery would be just fine. Thank you.
Good
Nope.
catch.
Mhm.
Make a note of that, Ellen.
Yeah, I did. Yeah.
Okay, we can scroll back down. Let's see. Oh yeah, without robust and ongoing supportive services seems an impossibility and destined to fail. Courts and agency rarely meet ASFA timelines. And then the last bullet, additionally, the right to rear one's own children is protected by substantive due process constitutionally. So addressing and fixing the system that is designed to reunify families need to be a priority. Requiring compliance with the permanency timelines is problematic. Commissioners agree that reunification that happens outside of the ASFA timelines is still in the best interest of children and families when the reunification is successful and the family no longer needs child welfare involvement. So any thoughts, reactions, changes on that? It's a long section.
Yeah, I tried to capture everybody's comments. Some of this came specifically from some of the things that Casey brought up. So, yeah, want to make sure that,
Yes, that captures my thoughts, and I really appreciate you putting it in there because, like I say, when I joined the commission, it very much was how are we doing looking at federal timelines, and we just weren't looking at outcomes for kids, which we know closing a case in a year is not necessarily the best thing if the kid and the family is coming right back into care. It's better to make sure we're achieving the ultimate goal, in my opinion. But I love the way it's written, and yeah. I think it captured what my thought was perfectly.
great, thanks. So we got 3, now Catherine's joining us right now.
Oh,
So,
wonderful.
yeah,
Let's see what, this is just page 2 we're on. Let's see, therapeutic homes with child-specific in-home support throughout the state. This might get really long to read all of. If we have silence and everyone kind of scans the bullets, does that work too? Thumbs up, thumbs down?
Yeah, that's fine.
Wonderful.
I just have a question about the language. Kin homes, is it kinship homes? Does it matter? I'm not sure what we're using.
Is it meant to be like the kith kin?
there's new language, maybe Donna could mention about this because there is a whole group, committee that's working on, the relative pathway. And so I know they've made lots of progress. Could you say something about that, Donna? Because I don't think we're saying kith kin anymore, right?
So kin is used nationally, so we sometimes say that, but in Oregon, for whatever reason, we have always used relative caregiver as the term, so it's really relative. But in our definition of relative, it's pretty expansive. It's not what might typically be as a legal relative definition. If the family identifies someone as a relative, we consider them a relative. If a tribe says they're a relative, they're a relative. Like we don't. But so kin homes isn't language we use in Oregon. It's typically relative.
So would it make more sense, Donna, if we changed it to, relative placements?
Yeah,
For-
yes, I think so. It'd be more clear.
Okay.
As long as folks know that it's relative in Oregon is defined broadly.
I second that.
So it
And-
could say relative placements and then in parentheses, defined broadly in Oregon, are not necessarily adequately trained to provide, would that work?
Relative placements as defined in Oregon, correct?
Well, that would work too. Mhm.
Yeah. Okay, we'll make that change. .1.
And I thought that one was important, clarifying the difference between therapeutic and treatment foster homes, as the terms are used interchangeably but are different in structure and scope. and also funding, I believe.
Where is that at? What point are you at now?
Oh, I was just echoing it because I think it's important. It's like 1, 2, 3, the fourth bullet down.
Okay, all right. Yeah, that's right. This became a real important point at that April meeting where people, this came up several times, so I wanted to make sure we did capture that therapeutic.
Yeah. Well, because there's some assumption that because they're relatives, you don't need that extra support and training, but those families have gone through trauma as well. Maybe there's ongoing trauma with the family members where the kids have been removed from. The family still needs that kind of support to be a therapeutic placement for the kids. So we are highly recommending that.
With that distinction between the treatment foster homes too.
Yeah. And then we say this is a critical priority that must be addressed in its entirety. All these pieces need to be addressed.
Yeah, the equalities regarding the rural versus the large city, I think, is a huge issue in general, even for the parents, you know, it's like.
Yeah, exactly. Like, how do you do visits? How do you do all sorts of things if you have to place the child 2 hours away from their birth parents, it doesn't work.
Yeah, or just in general, rural areas don't have as adequate like mental health supports or even ability to get appointments within a reasonable time for those supports, even if they do have them. That's just part of being in the country. It's a
Yep.
struggle. Yeah.
Any follow-up on that third recommendation? All right, so we get into recommendation 4. 1 and 2 child staffed homes throughout the state. That was recommended by the special master. I'll let you read that. Short and sweet. We want to make sure that these are quality placements with sufficient pay and training and support to be a good, safe, healthy placement for the kids. Any comments or questions on that? So number 5, trauma treatment to fit every child or youth, sorry.
I think this comes back in, and I think that Jessica may have mentioned it, but the rural area divide is sometimes problematic.
Somebody I'm sure knows the history on this more than I do, but I've been told by my boss who's been around Douglas County for about 25 years that, 10, 15, 20 years ago, they had great mental health services there. And they were essentially private organizations doing it who then sold to the state. And then over time, the state has closed some and merged others, and kind of changed it around, which then has now limited it. So I don't know if anybody else has any background on it, but it seems like what we're kind of asking here is to kind of go back to the model of having like more local based stuff rather than state funded. Well, I guess it could be state funded, but I don't know. I guess I'm just talking, but there's a history to this one. Am I right on that?
I'm not sure. Does anyone in this meeting have background on that?
I
I
don't
mean,
have any like statistical data, but I mean, just in general, our healthcare industry has been slowly declining. And I think COVID made a major hit as well, just with burnouts, without getting new people retrained. In WorkSource, where I work now, that's probably the most predominant need that we hear from employers is we need new trained medical providers. So compassion fatigue, for our mental health providers was just kind of overlooked for many years. And so we've seen an increase in that as well. Our medical providers actually needing medical providers. So yeah, I think historically we've just allowed those frontline workers to kind of take the brunt of it.
Mhm.
And we're seeing the results of it now.
Are we
Yeah.
still good with the recommendation of incentives for treatment foster care in every community?
Yeah, I wonder if off of what Jessica was saying, we need a line in here, Ellen, around this shortage of providers is a bigger issue than just child welfare, or something that, this is going to require broader collaboration to address. I don't know, some line like that.
Yeah, maybe I'll say something about, because obviously that's not something that we could control. We have a lot of say over it, but we could definitely look at that as a big picture item. So,
Well, and we make recommendations to the governor's office, ODHS, OHA as well.
Right.
So it's kind of asking them to collaborate more on that.
Yeah, and to collaborate with WorkSource too. I mean, WorkSource pays for these trainings, and a lot of people don't understand that, like quality mental health. I can't think of it right now, but Peer Mentor, CADCs, like we pay for those trainings. So there's also a collaboration I think that's missing in regards to that piece too, that you do have kind of this industry or this agency that is literally funded to fund trainings for people to get into the medical field, like CNA, phlebotomy, medical assistants, like all of those entry levels. So there's a collaboration that's missing from
So-
DHS, and yeah.
quick sentence on that. What would you like that to say? A summarization sentence, because that's that additionally there need to be more treatment providers and and collaboration with healthcare providers.
Yeah, due to the lack of adequate healthcare providers in our current industry and the decline after the pandemic, we also recommend a deep collaboration between ODHS, WSO, and what was the other one you said, Pamela?
The Health Authority.
Health Authority, that's right, OHA.
Okay. Thank you. Okay. So move down to 6 and 7.
All right. 6 is meeting a child or youth needs due to delayed development. I think that still stands. There are silos that need to be addressed and cross training and communication.
Okay. And 7.
Developmentally sound and trauma responsive approach to substance use.
Are we, Jamie, are we okay with substance use disorder? Do we want to, is that wrong wording there? I thought I'd captured that from what was said in the last meeting.
You captured it correctly. Substance use disorder. Yes, great job. Yeah.
The one thing on this one that I'm not following is it starts with this works for counties that choose to adopt it. There seems like there's something missing at the beginning of this recommendation. Is
there-
there a certain program? Is there a,
that the somehow or another, and I'm just going to admit that I don't quite remember what was said there, but that not all counties have to participate in this trauma responsive approach to substance use. So I'd had a couple of people who had said that that's great, 7 is great, and it works. If the county chooses to use it, but it's just not, it's not required. And the word treatment deserts was one that somebody had sent me in an email. So I thought that was kind of a good analogy.
yeah. So maybe just if you could say this trauma responsive approach works for counties that choose to adopt it, maybe that would just,
Yeah, that's fine.
fill
Is
in the
that
blank.
correct?
Yeah.
Is that the correct? Okay.
It's so sad. The word chooses, like when counties are choosing to adopt things that are great, and then also that means that other counties are choosing not to utilize things like trauma responsive approaches. It's heartbreaking. I'm wondering too, is it possible to change that language a little bit just to, this has, let's see, the trauma responsive approach has worked for counties who have utilized it, or, so it's less of a choice, although I recognize that we're not the ones making the choice here, and also pushing that it shouldn't be a choice.
Right. And maybe noting that it's a choice and that perhaps makes other counties who might not be using it say, oh gosh, that might be a better approach or something. So
This should not be a choice. All counties should be utilizing a trauma responsive approach. Yeah.
and maybe we'll say that all counties. Okay.
Thank you, Ellen.
No problem.
You're amazing.
All right. Next one we can still see here on the screen, a supported transition to lasting homes. And we didn't have a lot to say on that one.
And then, so yeah, these next ones here in the report are a little, we didn't have as much to say. So we can kind of, you're looking through those, like this number 9 is later addressed in the documents under the educational requirement, the recommendations.
That's right.
Right.
And then right sizing residential capacity
Yeah.
is a huge issue.
Well, I think what came from our meeting in April that I hope I captured here is that it was pretty much consensus that the recommendations, the first set of recommendations as we're going through the earlier ones in this document, were of a higher priority and immediacy, and for addressing specifically the temporary lodging issue. So that this right sizing, as we began to talk about it in April, seemed like a very big issue, and maybe more than, I mean, that would require a whole nother document just to talk about that particularly, is sort of what came up.
It's a whole nother beast.
Yeah.
I mean, there's a whole the Systems of Care Advisory Council working on.
Right, exactly. And we're going to do some, we'll have some more connection with them in these later months. I've been talking with the System of Care Advisory Council, and they'd like to do some partnership with the commission on creating, well, more collaborative goals between us. So I think that's going to be real exciting. So you all can look forward to that in probably late summer. Maybe that'll be something we'll take up at our September in-person meeting too. But I think that's this is something that maybe could even be discussed with them.
Yeah, I mean, absolutely.
So that's why 10 sub 1 and 2 we're just kind of included in that.
Gotcha.
So let's run down to, we got 11, 12, and 13.
Let's see, so new approaches to managing flexible individual support says should be directed towards HEC. Remind me what that stands for. I can't think of it right now.
I can't either right now.
Ellen, this is Gretchen. It's the Higher Education Coordinating.
There.
Oh, great, good. Okay, mine just went blank. I thought it had to do with education. I'm like, okay, can't remember what this acronym.
That's my contribution for the day.
Write that in here. It's never good in a document when you see an acronym that isn't spelled. So say that again. It's the Higher Education
Coordinating Commission.
Coordinating Commission. Great.
Yeah, is it commission or council? I can Google it real quick.
Oh, good.
I can never remember if it's commission or council.
I actually think it might be committee.
The committee.
It might
The
be.
Higher Education Coordinating Commission.
Commission?
Yeah.
Okay. All right.
That's
All right,
funny.
great. Thank you.
Sure.
Looks like Michelle hopping or had to hop off.
Oh, Michelle did? Oh, hopefully, if she comes back, there is something she did want to discuss with us that Rachel had put forward that she'd like us to hear from Michelle on. So, and I can't
Oh,
remember.
okay. She
the
did say
top-
she'd return if possible, so
She said she was coming back if possible?
Mhm. Yeah.
Okay, good. So let's just put a pin in now.
okay.
Okay.
Let's We conduct
Um,
monthly branch level interagency meetings for children with multiple placements.
How is number 12 different from number 1?
I was just gonna say that.
I think so too.
I mean, maybe this is just any placements, if you've had even 2 placements in that month, you would get your case looked at. I'm not sure.
I feel like this generally happens anyways. I mean, I'm not part of DHS, but I feel like in working with caseworkers, anytime there's multiple placements, they're at least staffing it with their supervisors. I don't know if this is, having a larger committee that's looking at it. But if there is, that seems like it's closer to number 1.
Yeah, and this is because we didn't make up number 12. This comes from her report. We're just addressing it. So, to me, I think it's just highlighting once again the importance of it. So making sure this intervention takes place. And maybe it depends on the branch. I don't know.
Well, and this looks like interagency meetings, so it's a bigger collaborative than
Agency.
staff internally.
Yeah.
So I guess the other recommendation is it will trigger a review internally by ODHS if there's been 3 placements. This one is every month there's interagency meetings looking at the children with multiple placements. It doesn't say who those agencies are, but I would imagine there's some different disciplines there.
Right.
And then let's see, create transition homes for children who cannot be prevented from emergency placement. And we didn't have a lot on that. There was some reference to, we used to have like a receiving center too at some point in the Portland area at least. And I don't know the details behind why it closed, but that's one of those areas that needs a longer term research on what is possible. Are there any jurisdictions doing it well? What would that look like and what would it cost? So
That one makes me nervous just because, when we look nationally, I mean, Oregon's one of the drivers on this kind of congregate care, bigger homes, and there's just so many problems with them. You come into it with the best intentions, but it seems like every time we have one of these large facilities, there's sex abuse, there's neglect. And you're further removed from your family. For instance, if this was in Portland and you're pulling kids from Jackson County down in Medford and Douglas County, you're making it, even harder for kids to see family. So I'm supportive of this one if the commission's supportive of it. Just personally, it makes me nervous.
Yeah, I wonder if we could note in there, Ellen,
Yeah, that's what I'm wondering
for
too.
that last sentence around, I'm kind of what he's getting at is those unintended consequences, but
Yeah,
we could say unintended consequences, for example, if there are receiving centers only in the major metropolitan areas, we would be pulling kids from their communities, which would be detrimental. So
And I
something,
think Senator Wyden just published a big report on this issue.
really? Oh, I'm gonna have to go find that.
okay,
I know that Annette Smith and Paris Hilton were in DC last week when they were unveiling the report.
Yeah. Oh, that's
I have not
right.
read it.
I went to undergrad with Annette, Casey.
She's the one that introduced me to you.
Yeah. I love her. She's fantastic.
if
Anyway,
if you would think about it and you find that later, maybe you could just send it, to me. I'm happy to send it out to everybody if you have a link to it, or you could even.
I'll see if I can grab it real quick while we're on here.
Yeah, how about, because I think this also, when we discussed this, we had that discussion on the unintended consequences and why it would need further study. So maybe the note could say something along the lines of the unintended consequences may outweigh the benefits due to pulling kids away from communities and families.
yeah, like unintended consequences such as, removing kids from their local communities, may be more detrimental.
Yeah.
than
So,
not.
I mean, I think that's one that feels to me, like it's more like a grabbing at straws kind of thing. So, like what's going to work. But, so yeah, I'll make sure we get a note in there. Okay, so moving on to,
See,
For-
a developmentally sound and trauma responsive approach to teen choices. And we talk about how it's addressed in the ILP program and actually funding the ILP program so that it can serve the 14-year-olds would be helpful.
Mhm. We did cover that because the funding was both insufficient and inadequate to cover the real expenses. And I believe that number came from our discussion with the ILP folks. I don't know if it was with our meeting with Rosemary, Pamela, or if that came from when we had a presentation.
I am not sure. I know that it used to be 40% back when I was doing data work, but I haven't seen anything recent. You might just want to circle that and double check it with the ILP folks.
Yeah, I think that came directly from them, but let's circle back because we want to see when it came.
Yeah.
Any
feedback on number 14?
One thing that I would add, I don't know if I would add it, but I just want to air it real quick. I recently discovered, in ILP, I keep pushing that we should address kids' medical and dental issues while they're in care so that they don't have those huge costs going into adulthood. And I recently discovered that it's very, very, very difficult to get kids in care braces because OHP does not cover braces, and you have to have a finding that it's medically necessary, which is kind of burdensome, but you have to jump through so many hoops to kind of get that basic dental care because OHP doesn't cover it. And I think that that's one of the things that, we should be addressing for kids. And I just noticed it in ILP because that's when I'm really pushing it as kids, have their adult teeth and they're kind of seeing what the issues are. They're usually, getting a little older by that time. I don't know if that fits in there, but being able to address their dental needs along with their medical needs seems important to kind of setting them up for success as well.
Okay, I'm gonna make a note of that. Yeah.
That's amazing, Casey. I know at one point there were some, like a collaborative of dental or orthodontia folks who would pro bono give braces to foster kids
And there
in
still
the
is.
area. Yeah,
There still is, and it's through, you have to go through, I think it's called Smiles. But you know, we're requiring on basic, we're relying on charity.
yeah, totally. Not
Always
okay.
frustrating.
Yeah.
Yeah. Okay. Well, I'll work on mentioning that for sure. And then when I send it back out, take a look at it, make sure that you, Casey, that the wording is what
And then let's see, next one, interagency services to stop juvenile department and hospital emergency department referrals to temp lodging. And that was all about putting a state agency in charge. And I think
I
that
think
wraps
that
up
was
the
last
special
one
factors.
of, and then we put the little statement here at the end.
Yeah, and our push here was that it needs to be intentional if certain recommendations are decided not to be pursued, that the commission wants to know why. And we need information on that and why it was abandoned or it was decided to go a different direction. So not just that 10 years down the road, half the things got dropped and we don't know why. Well, we'd like that to be documented and intentional.
Yeah. Okay. So is there anything else on the recommendations of the special master that we've addressed? I think we'll make those, I'll make those few changes and then I will make sure we get it to Rachel. And all of you will have the updated document to send out, and anybody else that wants it. It's not changed too dramatically, but I think it's significant. So we'll get that going. And then we can move on to the educational. Are we ready to do that? To move on to the educational recommendations?
I think so. And would Catherine be willing to just say a few words, having looked at these, what her thoughts are?
Yeah.
Sure.
Oh, I was just noticing too, we didn't take a break yet. Do we want to take that 10-minute break or do you want to keep going?
I'll put it back to everyone. How do we feel? Break time?
I could use the restroom.
All right, 10-minute break back at 10:30.
And then we'll hear from Catherine at 10:30.
Yeah. Thanks,
Is that good
Catherine.
with you, Catherine?
Welcome back, everyone, from your break. Hopefully you refilled some waters. So we're going to kick off now going over these educational recommendations. We have Catherine here, who's really kind of our state expert on, educational outcomes for foster youth. And she has graciously agreed to come and chat with us about the recommendations and see if there's anything we need to tweak. And just to recap, so the reason why we're going through these in such detail is because these recommendations are going to guide our work for years down the road, right? And so it's really important that we all understand where we're at, that we're in agreement, and that these are kind of the launching pad for work for the next at least 2 years. So that's why we're taking so much time. So I appreciate all your patience. I know it's not always the most fun to go through a document, but really important that we all are on the same page on this. So Catherine, thank you again for joining us. And what are your thoughts on what you've seen so far?
I love the first one. This is something I've been advocating for a couple of years. In May, I was able to go to the American Bar Association conference for the foster care points contact from Department of Eds and Child Welfare across the country. And we actually had Rebecca Jones-Gaston and her equivalent from the Department of Ed. They're doing updated guidance sometime in the fall around the Every Student Succeeds Act and the foster care provisions. And we got a chance to advocate, and this was one of the things that I was able to advocate. So I'm hoping maybe something comes out in the new federal guidance. I don't know what's going to be in there, but I really believe that if we are going to increase our grad rates, because those grad rates take into account kids that are in foster care for short periods of time and longer periods of time, I think we need to expand the protections for all of the kids that we work with in child welfare, and better matches the work that we're moving to with family preservation and in-home placements with families, because oftentimes what happens is a child may be able to keep their school of origin while they're in foster care, but they reunify with a parent and those protections are no longer in place. We have some ability to keep transportation going for a period of time if it works out, but we also have a lot of kids that come into our care and custody that don't ever get placed in foster care. And oftentimes those families are moving. Some of those cases might be domestic violence cases where a parent is separating from a partner and having to move to a new home. And I think school stability across those types of placements would be really good. I think the OKID data that they came out that showed mobility of these families outside of just the child welfare foster care system also supports that. So this is something I'm happy to see. It would require statute changes, and it would require probably a fiscal, because it would increase the transportation of kids to their school of origin. And that is paid for through a joint ODE, ODHS cost sharing agreement. But I think if our goal is to really, expand protections for kids that we're working for, this is an important one. Are there any questions on that?
Question on, so it says Washington recently increased their eligibility. Was that a statute change or was that administrative?
That was statute change.
Awesome. Okay, that's good to know.
And they may be the only state that has sort of expanded their definition beyond the federal Every Student Succeeds Act definition.
I'm not great at wordsmithing, but just, I know the legal definition, again, going back to it, ODHS custody with placement with parent, placement doesn't include parents. So just for using the right definition, I don't know if we could wordsmith that at all.
Yeah, so this is coming from our state statute mirrors the federal education definition of foster care. And that foster care definition specifically says placed away from parents. So it's really narrow to kids who are actually in a foster care placement. I do not know why they didn't use a similar definition of foster care that child welfare uses, or use something like care and custody. But it's a different definition than we're used to using in child welfare.
I guess what I was going to say is that if they didn't do their due diligence and they put us, if they made a statute change where they used placement, it would create a lot of legal issues, because we argue in court that, you know, the definition of placement is not with a parent, and then if there's a statute that says placement with parent, it kind of opens a bag of worms.
Oh, I see what you're saying.
What
On the
was
Okay.
second bullet.
What is your word choice change, Casey?
Well, that's what I was saying. I'm terrible at wordsmithing, and I'm not sure what term we actually use with parents. You know, that because once they've been placed, they've been removed, right? Generally.
But yeah, exactly. Do you have an idea, Catherine?
I kind of think that because this would require a statute change, I'm wondering if the group who would eventually be working on that could figure out a definition that would not mess up what you're talking about, but could expand the types of child welfare involvement that ESSA would protect around school of origin. So you could do something like eligible. So like Washington changed their eligibility to this, but that would not necessarily change their definition of foster care for child welfare. I think you could do some phrasing that would work around that.
I think if I was going to change it on here, I would probably say something like ODHS custody when children are in home with parent and have never entered foster care.
Yeah, Jamie had said in the chat, like in-home plan, question mark.
When children are in home, can you say that again? And
so I think I would change it to say ODHS custody when children are in home with parent and have never entered foster care.
So you would add that on top of the current definition, which includes children who are placed in foster care.
I still think that the term placed in, oh yes.
Okay.
okay, so you're saying, so ODHS custody, when children are in home and have never been in foster care. DHS custody when children are in home with parent and have never entered foster care.
I would say not and, because you could have or. So you could have kids that never entered foster care that are in our custody, and you could also have kids that are on trial reunification going back home who have been in foster care. So maybe one way of stating it could be foster care or custody. That's kind of used in some of the child welfare language and would encompass both those things.
I agree with Catherine. I actually, based on what you all just said with the trial reunification actually being listed, could it just say ODHS custody where the child never enters foster care?
Where the child never enters.
Would that work, Catherine, if you just remove the with placement with parent, because you have trial reunification down as the fourth bullet point, and ODHS custody where the child never enters foster care would be in home with parent?
Oh, okay. So you would leave trial reunification up there.
Yeah.
Okay.
I just,
I see.
clarify the second bullet point and just, I don't know if you need with placement with parent. I think it could just say ODHS custody where child never enters foster care.
I see. Okay.
Would that work,
Okay.
Catherine?
I got it. And you guys are both good with that?
And I was just tossing random stuff in the chat, so ignore all that.
Oh, I have to look at the
Trying to
chat.
capture your guys' words, but didn't quite. That sounds like we figured it out.
Yeah, if you wanted to simplify it, you could just say children in ODHS care and custody and not bullet point. And that would cover a lot. I don't know that it would cover CPS investigations and family preservation cases, but
What about children in state protective care?
I think that almost sounds like removal, though.
I guess that makes sense. Or in state, no, state housing care is different. So never mind.
Pamela, I think what you wrote on the bottom right fits perfectly for number 2, for the second bullet point there.
So if we just change the second bullet and we'll keep the first, third, and last bullet. That'll cover it all.
Yeah.
And is there anything else we want to say about Washington State, or are we making a recommendation that we follow something similar that in terms of statute changes? Because just as I'm reading back over that, I'm wondering if that's when we say we recommend that Oregon follow that. So we're recommending that Oregon look at changing statute to be similar to Washington. Is that true?
So that's true, but if we used Washington's definition of children who are the subject of a dependency proceeding, I think of a dependency proceeding as a court hearing, and a voluntary case or a CPS investigation, or maybe even a family preservation case doesn't necessarily arise to a dependency proceeding.
Yes, that's true.
So I think what we're saying is we want ours to be broader.
Yeah.
Okay.
Yeah. So
So
change
maybe-
the, we recommend that Oregon
Recommend that
expand
Oregon.
eligibility as well or something, rather than follow suit, because that makes you think.
Yeah, that's
on
exactly.
model
So we
Washington.
said recommend that Oregon expand, what was the last words you expand eligibility?
Eligibility.
Perfect.
Yeah, I just threw in Washington as an example of a state who has been successful in doing that.
Okay, I am going to, here is Judge Jacose with us, so this is great. All right, so we will move on. Are you ready for me to move on down to
Number 2.
number 2?
Yes. So this is having local child welfare points of contact at the local level to correspond with the foster care points of contact at the school district level. This is one of the federal recommendations. They strongly urge child welfare to have an education point of contact at the local level. We have not been able to make that work in Oregon. We tried at one point having points of contacts identified as an add-on to people's current jobs, and that was very unsuccessful because it ends up being a pretty big chunk of work. And so we also did a policy option package 2 years ago that didn't make its way through the process. That would have asked for funding from state legislature. So this is something that I think would really help us be more successful at the local level. When I did the policy option package previously, I think we were asking for local education point of contact for each district. at the local school district level, there are 197 school districts. So it's hard to match school district to child welfare branch, but I think by district was the easiest way for us to be able to think about that work. But I'm happy to answer any questions.
So I actually do have a slight wording suggestion for the points of contact. I would change that instead to service navigation. That's something that we're discussing like at a bunch of different commissions, using the term service navigation or service navigators instead, because that is more complete and like a more direct understanding of what people need. As we know, a lot of people are struggling with really navigating services in the state right now, as they've been for for a while. So I think that service navigation or service navigators, I think that would probably be the best phrasing personally. So, and I think it also is a more actionable specific.
Service
Are you
nav-
talking about in the first bullet, Dean?
Correct.
The identification and creation of
Yes,
service.
service navigation,
It's-
correct. Or service navigators, whichever you think flows more naturally in the paragraph and is more grammatically correct, I guess.
So Deanne, are you thinking of this position being more, when you say service, are you talking more than just education? Are you talking about all the services that the
Oh yeah, well, a little bit more than education, but also helping them navigate the services, helping them understand where the services are, and helping getting them in touch with that.
So it wouldn't necessarily be somebody more connected with ODE, but ODHS?
Potentially, yes.
I think it would be somebody who is working more at ODHS at the local level, who's working with the school districts in their area. And they could do a lot of different things around collaboration, identifying supports that are available in the community for students. Every district has different things that are available, and it's really hard to manage them from a statewide level because there's so many school districts. So that person would be working really closely with the local foster care points of contacts in the school districts, identifying what are the needs, what are the supports, helping to train caseworkers around how to get those supports, working with families. I think they could also be working with early education, early intervention, as well as K through 12. There's a lot of family preservation work that's working with our early learning, early education groups as well. So I think there's a big chunk of work that could be in that. I think you're using service navigation makes a lot of sense because that encompasses a lot of different things.
Do we want to
Yeah.
substitute service navigation for educational supports, or do we want to add it additionally as well? Educational supports and service navigation?
I think it sort of covers both at once. When you think about it, because you have to be educated, you have to be educating people on the services as well while navigating. So I guess educational and service navigation providers essentially would make sense.
Yeah, I'd be supportive of that. The one thing that I wouldn't want to get lost is that, we put a lot on, we've always put a lot on services, but I felt like, the thing that we were missing was nobody was talking to the kids about education. So that's the part I really wanted to come out of this, but as long as that's still a major focus of a service navigator, I'm happy with calling it whatever.
So
Yeah, and this is something that I especially hear about from a lot of foster youth in my area, because David Douglas School District has a lot of foster youth. So, so growing up, I saw that. So, and a lot of people and parents just they struggle to even figure out how to navigate all the services. So this I think will be a particular benefit to urban areas and especially rural areas. Suburban parents, due to their higher incomes, I believe have a little bit more time to navigate that. I could be wrong. That's just a guess. So anyone can correct me if I'm wrong about that. But I think that this will in particular help those two disenfranchised communities.
Okay, and so just to clarify, so this educational point of contact would be doing educational and service navigation. So we've got that in there, and then they'd be monitoring the educational outcomes. We would keep that as it is, because that's, you know, specifically, we're talking about education in here, and the data-driven interventions to support the academic, social, emotional needs of students in foster care. Is everyone okay with that? Continuing in that vein?
Yes.
I think the one other thing I might add or think about adding is a bullet around collaboration with local school districts, resource families, parents, and students in foster care.
Okay, say again, local school districts, parents.
Resource parents and students in foster care, or students involved in child welfare, something to that.
Students involved with child welfare.
Yeah, because the collaboration is a really big
Right.
piece of doing better in all of this. And I like what was said about including students in that collaboration. I think that's really important.
So with that, so we're moving down here, and these recommendations come from that ACF memo. Do we have anything further that we'd like to state here about what we would like to happen? Are we suggesting there be another pop on this? Are we what's our do we have addition? I guess what I'm asking is, do we want to be more specific in our recommendation?
I don't know if we want to just yet. I feel like after talking to Rachel, maybe then we come back as a committee or as a commission and take these recommendations and figure out what comes next. What do we recommend as a pop? What becomes maybe a bill? What is administrative change? Right? That's looking around like implementation of these recommendations. And we would do that.
And Rachel will be joining us in about 10 minutes or so. So we can also
Good.
ask her at that point. This might be a good one to bring up to see what that next step might look like.
And I agree with Pamela. I don't know if I'd add anything to it, but you know, just emphasizing that, and I think we're all in agreement that, you know, educational success should be a top priority of this, because when we look at the success of a child in care, them graduating high school is, you know, the bare minimum. I mean, you know, we don't want kids coming back into care. We know the people coming into care are generally low income and less educational attainment. So the more that we can do to set them up for success, you know, I think that's a way to reflect upon and say, we did a good job. This kid's, you know, going to be successful in life, and they're not going to come back with their own kids in a couple of years. So I'm just kind of talking, but I just, you know, I really want the governor to understand that we believe education is super important as part of CWP.
Yeah, great. And I think we'll have a chance to really let's make that point for sure when she comes on, because I think these you all have worked very hard on these things, and we've you know, we've tried to identify those things most relevant. Jessica?
Yeah, I was just wondering if anybody had any information regarding alternative education, because I know we keep talking about the bare minimum as graduating high school, but really there are some children that just don't thrive in that atmosphere. And so what other alternatives are there that, I mean, we can't just push one pathway. Like there's Job Corps, there's online school, there is GED testing. Like, do we have supports in place for alternative completion of high school as well? I mean, because I've worked with kids that some love school and some literally thrive with remote work where they do it themselves. So
Yeah.
Yeah.
I can give you a little bit of background as best as I can. In our administrative rules around education, we really have a process of identifying the right type of school, and our students can attend charter schools, alternative schools, GED, work source programs. We just write in our rules that the child's team needs to be involved in decision making around that, and that includes the child when those decisions are being made. And we have a number of our students are in alternative type of school placements. The good thing in Oregon is that alternative schools, charter schools are all under the public school umbrella. And so they're in the graduation rates, diploma rates as well. So those grad rates are not just from kids who are in public schools, those are alternative, charter, and then they also break out in the grad rates. I forget what type of diploma, but they've got a breakout for GED in there as well.
Mhm. And do we have something in place that kind of triggers that conversation? Like if there's like this child's having, has had 3 issues with the public school and they're expressing like they can't XYZ. Is there something in place similar to like the 3 movements of placement that's triggered to kind of have that conversation as a proactive way instead of a reactive?
Yeah, that's a good question. Our rules really have those conversations come into play when a school change is being thought about, since with the school of origin laws, the juvenile court has to consider any school changes. So I think that's in our rules. But what I will say is, in talking to caseworkers, I think these conversations are happening pretty frequently, especially when students are not being successful in their current education settings. And so sometimes these placements are made at the recommendation of a special education, IEP team. Sometimes they're being made outside of that special education. So they come into play in a lot of different arenas.
Okay, thank you.
Good
So
question.
So we have here, we moved to 3 and 4. 4 is something that I think Casey may want to go into some more detail. And I believe that there was some need to make some change to that. And so Catherine I remember that I've had so many different conversations about these, so we'll have, when we get to 4. But how are we with 3 and 4?
Yeah, I mean, I still think 3 is really important, like to have a coordinated, connected and driven plan from the governor's office would be amazing.
I love it. I think it would be really helpful. I did have some recommendations around 4. So do you want to finish with 3 first?
Yeah, is there anything else? I mean, I think we definitely, when Rachel gets on here soon, we definitely want to bring up 3. Is that correct?
Yeah.
Okay, yeah. Okay, and now, is everybody ready to move on to 4? And I don't want to rush anybody. I just was trying to be aware of the time. It's almost 11, so she'll be hopping on soon. And then also that we had some other things we wanted to make sure we got addressed. So ready to move to 4?
Yeah.
So the only recommendation I have on 4 is ODE is not responsible for notifying any local decisions. That's really the responsibility of the local education agency. In ODE, they call those LEAs. That's really a school district notification. So I think if you wanted ODE to be a part of it, maybe you could recommend rule writing, administrative rule writing around a requirement for LEAs to notify ODHS and children's attorneys prior to disciplinary meetings or actions. I think that would be a better role for ODE, or change the language to be the local education agency.
Would that require a rule change if we just said requirement that the local education agency notify the DHS?
There's currently no rules around this. So I think, you know, ODE is the rulemaking agency. And then the responsibility of following rules would be at the local education agency. So I think probably having some type of rules or guidance in place would help local education agencies follow through on that. I don't think that's something they're going to do on their own if it's not something actively being put out as guidance from ODE.
Thoughts on that, Casey?
Yeah, so I agree. However, it has to get done. I mean, the concern here, and I hear this from caseworkers too, how frustrated they are that, you know, disciplinary actions are happening with kids and then they're not notified until after the fact, and then we're not notified as attorneys until after the caseworker is notified. So there's a lot of frustration on both sides, and then we usually bring it up in court and the court's frustrated. So, you know, I think everybody's frustrated about this lack of communication, and what we're seeing is kids are getting suspended or expelled or kicked off sports teams, or whatever the reason, for minor issues that we could intervene with and protect their you know, their stability in their educational setting. So if it was ODE proffered language or drafted language that could be implemented by LEA, I'm confused on that one because I always think of law enforcement agencies.
You know, that's what I keep thinking.
Yeah,
So-
that was actually, it gets very confusing because we use the same words that mean very different things. So yeah, I think if you said a requirement that ODE develop guidance or rules that local education agencies notify ODHS and children's attorneys prior to disciplinary meetings or actions, would an ODE could decide whether guidance or rules is the way to go. And then in the recommendation, I would say the recommendation would ensure that youth who are suspended or expelled, the
would say-
suspension piece is important in there as well.
Could we say youth who are at risk of being expelled, rather than saying would ensure that youth are expelled at risk of being expelled?
I would say at risk of being suspended or expelled.
Okay, we'll get that.
Or even just at risk of disciplinary action.
Yes, yes. I think sometimes on the school side, they're very black and white, and they look at legal interpretations. And so suspension may not be at the risk of being expelled. So I would just want to make sure that we are sort of using, you know, at risk of disciplinary actions. Suspension, expulsion is commonly language used in ODE. I just want to make sure that it captures all of that.
Okay. Just a note, welcome Rachel. I think she's joined our meeting. What we are doing, this is Ellen, in case you can't see who's talking. And we've just been going through the recommendations that we shared with you. We spent some time on the temporary lodging recommendations. We've kind of talked through them, you know, where our emphasis is, and I think that's been fairly clear. We can answer any questions you have about that, but now we're working on the educational recommendations, and we do have a couple definitely wanted to circle back and discuss with you. However, just in noticing your time and joining us today, we'll also let you ask us any questions that you might have. So welcome.
Hi, thanks, Ellen. I'm happy to be here. I apologize. I don't have a lot of context. I just had on my appointment that there's a meeting from 11 to 12. So it sounds like you guys are midstream though. Is that right? And can you just orient me to kind of where we are and what's, I mean, I want to be here and listen. I mean, some of it is just listening and understanding where things are.
Yeah.
Is there an agenda item? Help me understand what you're seeking of me and I will be
Absolutely.
ready.
Yeah, we're going through the recommendations for the governor's office. We began with the temporary lodging recommendations where we went through each and every one of them. And we're going through that document now. I'm gonna just go up to the top because I'm sure you've seen this document, then we'll come back down here to the educational recommendations. And so what we've done is just going through and making sure we're still all on the same page about these things. We have a couple of small edits in the beginning, but we're looking at the special master's recommendations. And when we sent these to you, we just wanted to make sure that what we were prioritizing, and this was sort of the guidance we felt like we got from you prior to that April meeting, to look at each one of these things and then to prioritize what we felt was most important. And there's been a lot of discussion about it. I've had some discussion at child welfare with various people. We've had smaller discussions with the commission, but now we're having the full discussion around this. So this may look familiar to you. And the
And just
first
to confirm, Ellen, the last email I have on this topic was from April 30th. Is that right?
that would be when we sent this
Just
out.
making sure I have that's the draft and that you're working through. It just helps to set. Excellent.
Absolutely. Yeah, and now there'll be a new document coming out with the small changes we've made today. So we've been through this part, and then now we've moved into the educational recommendations, which was also something that we understood as important to the governor's office. So we have gone, and maybe we just want to revisit a couple of them because we've gone through these in some detail right now. And do you want to just jump back to this with the graduation rates in number 1, Catherine? Just quickly a summary for her of what we're wanting, what we're asking.
I think you're muted.
I thought I clicked it. Sorry about that. So the federal education protections for students in foster care on the Department of Ed side use a very specific definition of foster care that says children are placed away from their parents. So it doesn't really include all the types of families that we work with in child welfare. And we think that the School of Origin and education protections for kids in foster care should be expanded to basically students involved with the child welfare system. So they may be living at home with their parents. ODHS may have custody. It may be family preservation, trial reunification, just a larger encompassing definition of the students that we actually work with in child welfare.
So we spent a little bit of time on that one. Also, that since Washington had had done some changes, had some changes in statute, and we are changing the language that says that recommends that Oregon follows suit to recommend that. And I gotta find that. Recommend that Oregon expand eligibility. So that would be the recommendation of the commission, is instead of following the same thing that Oregon has done with their statute, but to expand eligibility. Does that make sense?
I'm not tracking the context in the specific areas, so I'm not prepared to speak to whether that makes sense or not. I'm not, it's not clear to me what statute you're referring and how this connects with our current work group that we have with HB 4086 that's looking at potential scope. So I want to listen and
I don't think
understand.
it impacts anything with 4086. Yeah.
Okay,
This is just around what kind of educational support services you have access to when you are not just fully removed from your home, but during the investigation, if DHS has custody, but you're still living at home with an in-home safety plan, if you're in the family reunification process, because right now you lose that, ability to remain in the school of origin and be transported and get help from ODE and going back and forth. You lose all of that in those cases. And so we're missing out on a chance to keep kids stable in their schooling by only saying that you have to be removed from your parent in order to get that service. So this would expand it. Yeah.
Thank you, Pam. That was a really clear explanation. I appreciate that.
Yeah, so this would be a statute change. We'd be looking at obviously that would, and then make administrative rule change, but anything else on that, Catherine?
Nope. Thank you for that explanation. This stuff is so in my brain. Sometimes it's hard for me to describe to people who don't know it as well. So.
And so, and then the other piece, important to circle back to it, was number 2, is about the educational points of contact at both the state level and the local child welfare branches. And this came from an ACF memo.
Yeah.
And Catherine, do you want to say a couple words to this one as well? Because we had some detailed discussion on it too.
Sure. So in the ACF memo, which is also a memo that works with Department of Ed at the federal level, they have required local foster care points of contacts at each school district. And we have those people assigned in every school district in Oregon. They highly recommend that child welfare also has local education foster care points of contacts. We have not been able to make that happen in Oregon. We've tried through an add-on to people's current positions, and that hasn't worked out well due to the level of work that it takes to be successful. We've tried through a policy option package, but we want to be in line with the federal recommendations that strongly urge us to have local foster care points of contacts. And so those people would really be working at the local level to help schools identify who the children are that child welfare is working with, creation of educational supports and navigating services at the local level, monitoring the educational outcomes and needs of students, data-driven interventions at the local level to support academic and social emotional needs of students in foster care. And then we were looking at adding another bullet that would be around collaboration with local education agencies, resource parents, and students involved in child welfare.
Any questions there, or did we cover that okay for you?
Sorry, Ellen, are you asking me? Is
Oh,
this
yeah.
like, okay, I feel like I'm just out of context of what this meeting was. So
Oh,
I'm
no.
sorry. I'm like just trying to understand what you're seeking of me and how. Because my understanding is you're going to come up with a list of recommendations, send a formal letter, and then we'll talk through those recommendations once they're just to understand. On that last item, my questions would be just understanding who is hiring those folks. Is it education schools that you want to have as the local points of contact, or is it within child welfare branches, and why? What's the best practice in the model for where those persons should be housed?
It would be child welfare. On the education side, school districts already have foster care points of contacts. And I certainly could present sort of a list of duties and things that those people would be doing. If that's helpful, I could get that to Ellen.
Yeah. And we're talking about this as somebody in the branches, because the issue being that there is nobody locally to work with. Right now, it falls to more of a statewide system, and we need people at the local level so kids aren't falling through the cracks. This would really make a huge difference in terms of supporting kids. And we've noticed that it can't really be a shared duty of some, like a caseworker with other duties. If you just handed these duties over to them, it's too big for just that. So we're looking for it to be a position. And sorry that that I did just jump into this with you. What we're trying to, we've been talking about this for a couple of hours now, because these are the recommendations that we're submitting to you. What we're doing is just honing in on them, but we have spent a lot of time with them. So they are pretty much in their completed form. They'll have a couple of small little changes, and then we can put a letter with it to say, these are our recommendations for what we feel should happen. And what we're looking for, and direction we're going to be looking for at the end of this, is to find out what you think the commission should be doing next to make sure that we can move these forward.
Well, and then also just updating on how what pieces of it might align with
Yeah.
your all's agenda out of COTEC's office and what you have coming down the pike for next full session. If there's anything here that fits already, we can jump on board with, or whether we're looking at, a standalone bill or working with the agency on a POP, whatever the thing is.
So then we were down at, we were at 4 when you hopped on, but 3 is something we did want to circle back with. Pamela, you want to, we were talking about, we wanted to make sure we talked to Rachel about number 3.
Yeah, so this recommendation came from the commission, really that the educational outcomes of foster youth have been kind of invisible for a really long time. So we would hope that there would be an effort with ODE, ODHS, and the governor's office to bring them together and create a state level educational outcomes plan for foster youth, like we have for a lot of other populations, and really lift that up and put some attention on it in a concerted way. So that's one of the recommendations.
And then in our number 4, where we were was realizing that ODE would not be the body to notify ODHS, but that it would be a local education agency. So the note that we have on this one, that the slight change will be that there will be a rule change needed and some guidance in place that would require, and if I say this incorrectly, please jump in, Casey or Catherine, for ODE to make the change that the local education agencies notify the children's attorneys prior to any who are at risk of any disciplinary action, suspension, or expulsion. And not just to just make sure that anybody who is at risk would have access to their attorneys. So that's the one we were working on. And Casey or Catherine, if you want to jump in on that.
Yeah, that was basically I was saying that a lot of what we see is that kids in foster care, I mean, naturally they're going to act out a little bit more, but what we don't want to see is that they are expelled or suspended, thereby, jeopardizing their whole educational attainment possibilities. We believe that if we could be involved, both caseworkers and attorneys, we can help protect their rights in school and make sure that they stay on track. And I hear all the time that, things are happening and the caseworker is notified after the fact, and then the attorneys are notified after that, and then the judge hears about it after that. And there's just frustration all around that could be minimized by saying, you know, we have an incident, we're going to address it at a meeting tomorrow. Both the caseworker and the attorney are invited.
And we do think that that requires a rule change, correct?
I think it would, I think in order to be implemented, it would need to be guidance or rules from ODE that go out to school districts. Because I think unless ODE tells school districts they should be doing this, it's not going to happen because it's not in statute. So I think however is the best way to make that happen. I don't know if you need a statute in order to have that be supported in rules, or if it would be enough for ODE to put out guidance saying, hey, we really expect school districts to be including these folks in these meetings. That would probably need to be a conversation with ODE, but I think it could happen a number of different ways.
It might go back to that interdisciplinary plan that of number, the state level education outcomes plan could also include it. If we had that.
Yep.
All right, so now we'll move on down. We were at number 5. I think that, and we're nearing the end of these, the educational. And we only have a couple of the additional recommendations. So let's get through our number 5. And then we'll move on to the other. And I think we still have Alexis with us, so she might be able to help us with some of the additional ones as well. So in number 5, this we did have, we've had some discussion with IOP. And this is the one that circles back from the special master recommendation number 9. And would somebody like to talk a little bit more about this one?
Yeah, this is really supporting ILP as the state and federal program for independent living for foster youth. And you'll, if you go back up to recommendation number 9, it asks for funding for the program because right now it's supposed to serve youth 14 and up in foster care, but because of limited funds, they bumped it to 16 and up, and they're only serving less than half of the 16 and up-year-olds. And so you're missing a whole category of 14, 15-year-olds. Less than half of those older than that are getting this independent living program support. So we're looking at what would it be like to actually fund that, because one of their goals is working with youth on their transition and educational outcomes. And so you've already got bodies and program and infrastructure across the whole state to support foster youth in transition, and they don't have what they need to be successful. And so when we're looking at educational outcomes, we cannot ignore the ILP program and what they could offer. So it's really around that.
And we did definitely, I think the foster care tuition waiver kept coming up from numerous places that it wasn't sufficient.
Yeah,
And then-
the tuition waiver is last dollar, and you have to be younger than 25. Creates a lot of barriers to folks using it. You know, if foster youth are on a slower track to kind of come back to school and try and achieve a higher education, they might be out of the age range. And we hear a lot of youth coming back after 25 and they've missed the window. So there is a desire across the state to eliminate that age barrier and also look at it not being last dollar, which was always the intent of the bill, I have to say, because it helped pass it. We never intended it to be stuck like this for a decade, but you know, here we are.
Do we have anything else on that number 4? Or number 5, I'm sorry.
I would just put in a pitch for fully funding IOP. That's something that already exists, that it wouldn't take a lot for us to do, but would make a huge impact both in the rural areas of the state and in places where we don't have a lot of programming. Just having that person there to work with those younger age kids, if we try and dump it all on them when they're 16 and then they age out, you know, as soon as a lot of kids choose not to go on until they're 25, but we need to get them those skills before they leave the system. So would make a big difference in probably half of the cases where we have kids end up out there not ready to be adults.
Thank you.
Yeah, Judge Bo.
So the additional recommendations, these are the last two of the ones we've addressed. And like I said, we will go, I will be updating them, getting them out to the commission, and I'll get them to you as well, Rachel, and we can talk about what things we need to, where we can be of assistance from there on out. But number 6 is this removing reasonable efforts from the statute and making active efforts for the law of all. And maybe Judge Jaco and Casey can also speak to this. I think this specifically came from some of the things you mentioned in our April 11th meeting. Judge, so maybe you want to say a few words about that.
Sure. So in order to remove an Indian child from their home, the agency needs to make active efforts to ensure that first they try and work with the family to make sure that the child can safely stay in the home. And that is something that should be happening with all of our families. There's research going back for decades about how much better children do if you can work from within the family rather than remove them, create that additional trauma of removing the child, placing them somewhere else, trying to work with the family separately. If you keep the child in the home and can work with the family as a unit, it's more successful. It's less likely to become an intergenerational trauma. And so we think that the more that we can try and incentivize working with families together and doing the work on the front end so we don't ever have to remove, the more economical as well as healthy our society will be. So that's one of the things we'd really like to see, is getting to that active efforts on the front end for all kids.
Completely agree with Judge Jaco. I think that this would be a major game changer, because it would, obviously this would cost a lot more resources up front. You're requiring more from each caseworker to prevent or eliminate the need for removal. But if you can prevent or eliminate the need for removal, you're saving a lot of funds by the kids coming into resource care. You're also freeing up a lot of resource homes to address all of the temporary lodging issues we had. So, to me, this is a major game changer. I absolutely understand why we have a higher threshold for Indian children, but when you look at it from the reverse point of view, and you say, well, because you're not an Indian child, we don't have to work as hard to keep you with your family, that's a frustrating point of view. And so, there's so many cases where if we just did a little bit more upfront, the kids are never removed. And we know that once you're removed, you've got that lifelong trauma. So this is one that I think would be a game changer, really, in DHS.
Thanks, Casey and Judge Jaco.
I'd be curious just to understand from the DHS perspective, like what is the difference in terms of efforts and process between reasonable efforts versus active efforts, and how you would view that in practice? I'd really want to understand that.
I can just give you one quick example. So on reasonable efforts, if the agency's offering substance abuse or substance use services to a parent, that is reasonable efforts. Active efforts would say, oh, you have an inability to get to the treatment provider. We're going to make sure that you have a ride to get to the treatment provider. And so it's really providing the full service rather than just referrals, is one way that I view it.
That's helpful.
Thanks, Casey.
And I think we could circle back with DHS on that question too, if we do pursue this recommendation I wouldn't want to put anyone on the team on the spot right here to jump in unless they really wanted to, but maybe that's something we could send back with the child welfare team for feedback.
Pamela, I could just add that I think that what might really dovetail well with this is all the prevention efforts being done. I'm going to just be really transparent and say I'm not somebody. Hi, Rachel. I work in the foster care program in child welfare DHS, assistant manager there. So I'm not somebody who's going to say what position we might have on this. But I do think the prevention work really does fit pretty well with active efforts. It is what it is our vision for transformation. It's definitely our leadership perspective is to do is just what Judge Jaco was just discussing, and that is keeping kids at home and keeping kids with their family. I think it's an interesting conversation. And when I read this recommendation, when Ellen sent them out, it was very intriguing to me. I have not heard anybody ever make this recommendation before, at least in some sort of official capacity, that we just look at active efforts across the board. So it's definitely a conversation that we could have Stacy and I could take back, or Rachel, to our leadership.
And when I was meeting with safety group, Donna, the other day, their manager, and basically everyone was saying that they really liked this number 6. They were all for it because there's a lot of prevention educators there, and they said it's critical. So I think we could find consensus.
That's exciting. And then the last recommendation here is, we do have the Governor's Advocacy Office. There is a foster care ombudsman in it. We have our the newest Alexis here is the new ombudsman, if you haven't met her. And we know that there's a lot of data that comes out of that office. They're tracking everything, the timelines of the calls, the topics, the outcomes. And what we have found is that they publish the basic numbers, but never recommendations. And it turns out that the GAO does actually have recommendations, and they only keep them internal. And they give them directly to child welfare, and no one ever sees them. They do not see the light of day. So we, as the commission, would like to see those recommendations that come out of the GAO and have them regularly published. So we can be monitoring what's changed, what's moving forward, what's not, and why. So that's the last recommendation, is just, we want some transparency and collaboration around those findings.
And Alexis, do you have anything? I mean, you're brand new here as the ombuds, but do you have anything that you would like to?
Yeah, the only other thing that I would add to that is that I just recently was able to go up to the Capitol, and in prep for going up there to present to one of the committees, we had looked at the recommendations for 2023, and I'm still playing a lot of catch up, trying to understand the office and how all of the nuances work and where things go. But it was very interesting to me that the recommendations are not published. I think, and I read through all of the recommendations for 2023. There was 27. There's some amazing information in there, and it's more of a macro scope. So it's not just on a specific case. It's more of a broad, interpretation of what's happening. Sometimes it's based on trends. I just really feel like this is a great recommendation, and I love to see that this is on here.
Great, thanks. And it was partly Darren had brought this to our attention because we were asking him for recommendations, and he really was able to share them with us. We had our discussion that in that vision for transformation and talking about transparency, this fits right into that, and to disinclude it kind of doesn't make sense. So that's why it made its way in here.
I love it.
Great. So basically, those are the recommendations, and so I will get these together, and we'll we have just a few small changes. Nothing really significant has changed. So we'll just tidy it up. I'll get that back to you, Rachel. We'll put together a letter from Pamela, and then we'll we'll kind of wait to hear what you would like us to do, because we're happy to help, write letters, just figuring out what our role is for helping move these things forward. And especially around the special master's report as well, because we do feel that that was an important document, and we want to be able to be of assistance in making that happen, making what she has suggested, bring it to the light of day. And that was just kind of our ending statement. Did you have any questions for the group?
Ellen, thank you. That's what I would first say is thank you. I look forward to reading, especially the first half. I know we didn't get a chance to go through that in detail yet. But just seeing what the recommendations are, where there's nuance, where there's just very practical, like application to understand how do policy ideas actually work on the ground when you're working with kids and families is just so important. I can tell you that there's a lot of, as you know, a lot of similar themes, right? Where we're hearing and understand kind of traction. So I will gladly, I'm excited to get the letter and to kind of read through some of these in detail, and I think kind of talk through and understand where and how some of these recommendations can be advanced. One thing that we always have to navigate is it's always going to be helpful at some point to hear prioritization, where if you had to pick like the top 3, because sometimes you can't do everything. Sometimes you won't be successful. Where do we really target, and where do we kind of see momentum building, and where do we kind of help marshal resources? I think those are going to be some of those kind of discussions that I foresee in our future. I'll just identify.
Yeah. And thank you for that. I think that's great. One of the things, I'll just quickly scroll back to the top, that the commissioners were discussing has been around. We kind of did that with the Marty Beyer report.
Okay.
What most important, we like this placement stability, the first ones, I believe probably the first 4 at least were the critical places. Then the rest we kind of noted they're important, but maybe they might not be the first step, the first priority. And then as we got to the bottom, especially in the right sizing residential capacity, not that it's not important, but that it kind of is a whole nother beast, I think was the word used. And so the priority being some of those things that are in the first part of her report and not toward the end, are the things we were suggesting be addressed first. But when we get that to you, we can always schedule a meeting or a shorter meeting or another meeting that we notice with you if we want to, if there's certain things you want to discuss further, and people can elaborate on those things.
Yeah, and we can go back to some of the educational recommendations and decide as a commission, if we had to stagger them, where would we start? I think we could have that conversation too.
Well, and would it be helpful for us to, in our letter outline, if we're looking at things that would be the biggest bang for our buck, that would be these things. If we're looking at things that we could accomplish in a shorter time frame, that would be these things. Most important as far as these kids being successful, identify a few things there. Is that what you're wanting? Is just some sort of a focus? I mean, we don't know what criteria the governor's office is going to use to decide what to move forward with. We think these are all important, but as far as if we can identify things that would be easier or more difficult to accomplish, is that what you're wanting from us?
Judge, I think that lens is always helpful. And at the same time, I do think that could be part of our iterative process as we kind of look through this. It seems as if timing wise, I believe kind of excuse me, it's important for you to get the recommendations out probably sooner rather than later, and to have that delay a process so that we can have a public discussion and understand what you're formally asking of as the governor's advisory council to the governor. And if that's kind of perhaps follow-up we need to do, or maybe that's how we respond in terms of like a next iteration, I think we can navigate that process. But I feel like, you know, it's going to be important to get this list of recommendations from you. So thank
And
you.
also, and thank you for that. And just a note that on the educational ones, on the 1 and 2, especially, think 1 and 2 and 3, these are ones that we, in working with our, doing this educational kind of symposium, so to speak, for the last several months, talking with people, these are the ones that came up as the priorities, I think. And working with Catherine from Child Welfare about 1 and 2, especially being really kind of critical for moving work forward.
Yeah, and we can highlight that in the letter,
Yeah, we sure can.
give a little background on it. I don't know how much more time we have you for, Rachel. I think it looks like you were supposed to be hopping off here soon, but is there anything from the governor's office coming out of the short session, heading into another long session, anything you want us to know, any priorities that you're looking at that align with what we're looking at?
Yeah, absolutely. I'm happy to speak for just a few minutes and kind of give you a little bit of the landscape where things are, just so we know. End of June. First, you're going to just see that we're launching our formal budget development process for 25-27. How that will work this year is different from how sometimes things have been working with agency and governor's budgets in the past. Specifically, the agencies have been given very firm spending kind of budgeting caps, if you will, based on where things are with just the state of the budget environment. Agencies have been asked to put a 1% cap on any sort of additional needs that they might have for budget request from the agency's budget request process. That means that some of the things that we all might want to do, you're not going to see in the ARB process. And I just want to flag that, because the ARB process that you're going to see will have a limited list of items that can be done within that spending limit. And ARB is agency request budget. So how the budget process works is there's an agency requested budget process that usually happens first. So right now what will happen is, like, starting next week, actually next week, you're probably invited you might have all received an email already from Department of Human Services. There's a budget launch meeting on the 25th where they're sharing information. Director Paksharas is sharing information about the agency requested budget process and kind of helping to explain how DHS looked at prioritizing what was included in that budget request. Separately, there's separate processes that the governor has in place where she is looking at request for housing, homelessness interventions, behavioral health, and education. So across those initiatives, you're going to see an array of options that the initiative directors have put together that are part of what the agencies have requested potentially as ideas that could fall into these parameters. But it's not all inclusive yet. And I just want to note, because part of the process that happens is then over July and August and September, especially, we're getting feedback on recommendations from partners and identification of where there might be things that have fallen short that we need to be thinking about differently for the budget process. And so that's where I just want to acknowledge your letter is really helpful, because you're helping to identify, hey, here's what might be in the department's budget, but then you're also perhaps flagging for us more specifically, this is where you may have concerns about where things were prioritized and or where you would recommend additional recommendations or prioritization from your seat. And then that's kind of the process that it's just kind of this incremental process that we have that we'll be moving into as we go into, July and August, and then September, October, November, December, as we finalize the governor's budget. So kind of agency request budget process and governor's final recommended budget. And then even then, right, even though it's a governor's recommended budget, that's not the end all be all. That needs to then go into the legislative discussions, and a lot of these discussions are going to be done where we're all going to be monitoring at different periods of time throughout this process the budget forecast, and where are things with the budget forecast to understand how do you calibrate where you can scale up versus scale down based on where available dollars are showing that are available. And so that's kind of part of this iterative process that you're going to see over the next 6 months or so. So hopefully that gives a little bit of landscape. You'll just expect that you'll have some engagement meetings with DHS in particular over the next few months. In the meantime, you're kind of raising and escalating where you see gaps, where you would want to make sure that we are leaning in differently. And that's part of what we'll continue to discuss as we go through this process. Questions?
No questions, but thank you, Rachel, for this comprehensive breakdown.
Yeah, absolutely. And you'll see some, if you go to the DHS meetings and we can send it out afterwards, they'll have some nice timelines as well. So you kind of can understand what those timelines will be. And that will be what is part of those public presentations.
That's really helpful. Ellen, will you make sure that commissioners get links to those
Yep.
meetings coming up? Thank you.
Absolutely. And I'll keep an eye out for it. I haven't seen anything yet. So. You think it's going to be coming out next week? Is that what?
I think that's when the meeting is. It's on the 25th.
Ellen, I can connect you with the DHS folks who are leading that. Yeah.
Perfect. Thank you.
Okay. Thank you.
Cool. So then we'll plan to clean these up and get them back to you. We'll be looking at this agency budget request process, and if there's anything we need to weigh in on separately from our recommendations. And then we will schedule some more time with you once you've had time to digest what we've sent over and talk about next steps.
That sounds excellent. Thank you, Pam.
Yeah. Thank you for joining us.
Thank you all.
Thanks.
All right. Bye-bye.
Bye, Rachel.
Nice to meet you, Rachel.
Great.
All right.
So we'll look for that. Donna, do you know if that's gone out, or have I just not seen that, or have you seen anything on that meeting she was talking about?
I haven't. We can connect about it though. I can connect with Stacy about it.
Yeah, I think I'm not on that email list anymore. At one point I was, but I'm not anymore for the kind of public engagement stuff. So we should.
Well, I'll make sure that all the commissioners have the info to attend.
Thank you.
As soon as I get it.
All right. Well, we are coming up on the noon hour. Let's see.
We still have to, now we have a quorum because we have Judge Chacot. So we can go back and circle back. We do have our minutes to approve, and we did have our election.
Is Jamie back?
Did Jamie make it back?
Oh yeah, there she is.
Yes, I'm here.
Okay, good. Do we have everybody? Okay, I'm going to stop sharing my screen so I can see everybody again.
7.
Okay. Good. Yeah.
That's 7. Oh, that's still a quorum, right? Okay. So really quickly, if you can circle back to the minutes, I think Ellen are those attached to the meeting invite or just in the email?
They should have been, yeah.
Okay. So if you've had a chance to look over those, Would anybody like to make a motion to approve the March 2024 meeting minutes?
I move to approve the March 2024 meeting minutes.
And I'll second it.
Thank you. And is it any discussion? All right, all in favor? Any opposed? This is just for commissioners, don't worry, Alexis. Any abstaining from voting? All right, March meeting minutes approved. Make note of that in the notes. What's that, Alexis? Like, wait, what are we doing? So then we will go through the same process for elections. And at this point, looking at all three positions open. So I'm going to go through a process for each one, starting with maybe secretary. So our current nomination for secretary is Alicia. Is there anyone else who would like to put their name forward at this time to be our secretary? Going once. Twice. All right. All in favor of nominating Alicia as our secretary for another term? All in favor, say aye.
Aye.
Or show of hand.
Aye.
Aye.
Any opposed? Any abstentions? All right. Alicia has officially been elected for another term as our secretary. Congrats, Alicia. She's not here. She had an emergency if you came in late. We will let her know. So then the vice chair position, we have Jessica, who has stepped forward and put her name up for vice chair of the commission. Is there anyone else at this time who would like to put their name forward? Alrighty. So all in favor of not accepting the nomination of Jessica Hawash as the vice chair of the commission, please say aye or a show of hand.
Aye.
Aye.
Any opposed? Any abstentions? All right. Congratulations, Jessica.
Yay,
Thank you,
thank
Jessica.
you.
We will let Mamadou know he's off the hook. Thank you for joining the leadership team.
Yes, thank you for having me.
So
And
do we
then,
now go to chair?
yes, so chair position is also open, and I have agreed to do another year, not a full 2-year term, to fill in until someone would like to replace me. So at this point, my name is in the hat. Is there anyone else who would like to step forward for the chair position?
Not stepping forward for, right now because I have just, finally like been able to get on here, but interested maybe next year once I get a full hang of things,
Wonderful.
depending on how busy my schedule is.
And just a note too, that Jessica has also expressed an interest in the chair position, and part of her coming into the vice chair has been to kind of get an idea for the stuff that Pamela's, all the work that Pamela puts into it, and to be part of that. And so that's great, Deanne. So that, down maybe by next year and you stepping into kind of learning that a role too would be great.
I have a question. Yeah, so I didn't go forward for any leadership stuff here because it's the end of my term. How's that work? Because I know that I could be reappointed.
I'm kind of assuming that you want to be reappointed because you're 2025, aren't you, Casey?
I am. And so
Okay.
that's why I didn't bring anything up. So I wasn't sure if I was off the commission in March, although I now understand people have done multiple terms. I don't think I was recognizing that at the beginning.
Yeah, no, and hopefully you will stay, and hopefully everybody will stay for their 2 terms. I think we have people that have generally, that's been the case, correct, Pamela? And
Yeah,
also,
so Governor Brown had a 2-term limit for commissions. We are not limited in terms legally, but just as a practice, Governor Brown wanted people to rotate off after 2 terms to keep the commissions fresh. I don't know what Governor Kotek's, I haven't heard any guidance on that. I don't think that they have the same expectations. So at least 2 terms, and under Kotek's office, it might be more if folks wanted to stay on.
And sometimes it takes that long to really understand and get going and start making movement forward. It's not like we only meet 6 times a year.
Yeah.
So, yeah, and for the
Are you
people,
putting your name forward then, Casey? Is that happening right now?
oh,
Oh, dang it.
So I didn't talk to anybody about it. I was just, I was thinking about it. And I'm now more in a position to be more flexible since I'm leaving my firm. Before I had a lot of, if somebody was out sick, I really had to be there to cover for them. So I'll have a little bit more flexibility in building my own schedule, but I haven't had any conversations. I think, Pamela, you're great to do it for now. If we want to have a conversation, if you're really wanting out of the position, I respect that, and we can have that conversation. I don't want you to feel like you have to be the chair because nobody else is stepping forward. So maybe that's something that if you're comfortable doing it now, great, and we can have conversations offline about it.
Looks like we'll have a contested convention next year.
I know. I'm so excited for this. This is what I've been wanting. I want to see a vote off here. So for the moment, it is myself being proposed as continuing as the chair of the commission. So all in favor of my continued role as chair, please say aye or note with your hand.
Aye.
Aye.
Any opposed?
Aye.
Any abstentions? All right, gavel goes. I will remain as chair. Thank you all for entrusting me in this role. It has been a journey.
Thank you for all your work.
Yeah.
It's
great work.
I've said this before, probably in all of our meetings, but I've just been really, really impressed with the last couple of years and the direction that the committee's taken and how we're really like putting forth concrete things that can improve the system. And so I've loved the leadership, and I've loved your leadership, Pamela. And I've just been really impressed with the momentum that the commission's heading on. And Ellen, you've been a big part of that the last year as well, and as of all of the commissioners. So
I look forward to getting to know each of you quite well, because I'm excited to really work with you all on this thing, especially because this is related to my race to council, but also related to the homelessness situation. The fact that like we've seen the state basically increase homelessness by having a few strict things that they are often, so this is a serious issue statewide and in the city. So.
Yeah, absolutely. And unfortunately, foster youth are highly represented in our homeless population, former foster youth.
Yep.
It's a very sad day for alumni.
And as far as the people whose positions end in 2025, what I'll do is we can talk. I'll talk with each of you individually so we can get started in the resubmittal through Workday. I think I'm not sure exactly how that process looks, but we'll figure that out and make sure that's all in the works for next. It's hard to believe that it's already, it's summer, and March next year seems like a long ways away, but it really isn't. So we'll get that going.
Yeah, and I had to do a resubmission, and it was, I think I resubmitted most of my info. I updated the kind of essay they make you do, and otherwise everything else was the same, and hit the button and it went through. So I don't think it's too
pretty easy if you go into your Workday and then you just, yeah. Well, we'll make sure.
Question it. And then I missed the confirmation hearing and still got appointed. So, you don't even have to go and you'll still make the spot. So we have a little bit of business. I know it's lunchtime. I'm starving. This has been a really heavy meeting with content and editing, and my brain is fried. So the last of our meeting we had was talking about the retreat, I think. And so I would love to toss some things out in the air for you to think about, and then we'll talk about it next time. Does that work? You can mull
Works for
over.
me, yes.
I don't know about you, Ellen, but my brain is toast.
Yeah.
And I still have 3 more hours straight of meetings that I have to somehow make it through. But so for the retreat, we're looking at September 16th still in person, probably in the Salem area. We are going to invite the governor to speak. That's normally what we did in the past, and Governor Brown did show up about probably half the time, which was pretty nice. And then we can talk about our recommendations. We'll have a lot of workshop time to move things forward. We'll have networking time to get to know one another better. We do have so many new commissioners that we would love to get to know better and just connect on that personal level, because we haven't had an in-person commission event since 2018. So it's been a long time since any of us have seen each other in person. We'll probably have some data presentations, ask Rachel about next steps. What else? We usually have some sort of speaker come to the commission retreat to either frame up whatever issue we're going to be grappling with, or as an energizer kind of inspirational talk. So just be thinking about who you've seen or heard from recently that you really enjoyed, who you might want to put forth. I know when we planned the retreat that didn't happen, we were talking about a panel of folks with lived experience. So if anyone still thinks that is a great idea that we could go with, I think it is. I would love it. Then we could revisit who was going to reach out to who on a panel of folks with lived experience and bring them in. So is there anything else, Ellen, to be thinking about around the retreat that we could get just little seeds planted?
I think you covered it all. We were just going to hone in on some more of the specifics, but we don't have that yet, but probably what we want to do is make sure we get this on the governor's calendar like right away. So when we meet again, Pamela, maybe we should meet in the next, week or 2 weeks, because we've got to tidy up these recommendations, get them off to everybody. Everybody will be seeing those. And then if we can make sure that we follow up on deciding about who we want to speak, so I can reach out to them, and then also reaching out to the governor's office. If we get at least a little bit of a timeline for how the day will go, that'll help, I think, because people will ask for specifics.
Yeah, I
And-
mean, as far as the governor is coming, we basically bumped anything on the agenda for whenever the governor could come. So if they've got 10 minutes to pop in, we will juggle the agenda around her. So
Perfect. Yeah. Okay, so we can look at that a little bit more detail. If we do want to have an executive committee meeting with our new executive committee, we just have to notice it through the transparency site, and put it on the website as well. So, but there's no reason we couldn't do that.
yeah, absolutely.
So it's
All right,
something.
so be thinking of speakers and what your goals would be out of the retreat. And then we will put some focus time on it next time. In the meantime, enjoy your life in the hot weather and everything you've all got going on. I know it's a lot, and just appreciate you all. And we will see you at your next meeting. When's our next meeting, Ellen?
Our next meeting is next month in July. The third Monday in July. And also thank you for doing these minutes, Alexis. Not even a commissioner, and you deserve like a major gold star today.
You can't say that till you see what I did. So
Okay, we're gonna withhold our thing.
yeah, thank you. I recommend it.
It's July.
There we go.
July
15th.
No, it's 22nd, I believe, isn't it? Or is it?
Oh, I have it on my calendar for the 15th. Let's see.
Is it the 3rd or the 4th?
It's the 3rd, so it would be the 15th, I think.
Well, I'm heading now. All of you have a great day.
All right, thank you.
I'm not counting the 1st.
Right.
Sorry about that.
So
It's
see you all July 15th. In the meantime, take care. Have a great rest of your day.
Thanks,
Ellen, should I
everybody.
send these to you?
Yeah, go ahead and send them to
Okay.
me, and we'll just
Okay.
chat next week.
Okay, cool. Bye.
Bye.